Naomi has been living with rheumatoid arthritis for over 15 years, a chronic autoimmune disorder that has affected her daily life. Throughout the years, Naomi has explored various treatment options to ease her symptoms, including medications and physical therapy. As her condition has progressed and become more challenging to manage, Naomi is now contemplating hip replacement surgery as a viable option to restore her mobility and enhance her overall quality of life. To facilitate this surgical procedure, she is actively seeking financial support. Our reporter Dolly Murigi Mbuvi engaged in a conversation with Naomi to delve deeper into her experiences and aspirations, and here is Naomi's story.
You know, rheumatoid is in the blood. According to the way the science, it's in the blood. So most probably, I was born with it.
In a world where every day is a battle against pain and uncertainty, one woman's journey stands out. Meet Naomi, a resilient soul who has been living with rheumatoid arthritis for over 15 years. Raised in a loving family of 5, Naomi's childhood was filled with laughter and dreams. But as she transitioned to college at the age of 19, everything changed.
I came to Nairobi for college, to pursue college education. So reaching 19 years, that's when I started experiencing pain in my joint, especially the knee joint, this right knee. It was so painful that at times waking up was a problem. And in classes at times I used to experience pain, inflammation, you feel like hotness in that joint. Discomfort, great discomfort, such that after like 2 to 3 weeks I decided to go and see a doctor who was in the college. So he used to give me painkillers. I used to have a little bit of temperature, sometimes I shiver. So when I took the painkillers, I used to feel better. I can stay for like a month without pain, 2 months, 3 months, then it starts all over again.
It was during those formative years that the symptoms persisted, a condition that would alter the course of a life forever.
Post college, so I traveled from Nairobi to Mombasa. When I reached Mombasa, that day after refreshing, I decided to rest. After resting, reaching in the evening, I tried to wake up, I couldn't. I tried to move my legs, I couldn't even be able to do it, even my hands. So I called my mom, I explained to her. She had to help me sitting, standing, going to the toilet, getting in the bathroom. Then after like 2 days, she bought for me painkillers. After like a week, I was back on my feet again. Though I was a bit worried, so I told my mom, see, we go to the hospital. She was like, no, the painkillers have helped, it is okay.
However, as weeks turned into months, the symptoms worsened. After several visits to various healthcare providers, Naomi received a diagnosis that will define a journey forever: rheumatoid arthritis.
After a while of taking the painkillers, the doctor decided that I should do tests to see what the problem is. So I went for blood tests, and when the results came, he called me and he told me the rheumatoid factor is positive in my body. So by then I couldn't understand what it was. So he just told me it affects the joints. But then my mom was a nurse. I called her and I explained to her. It's like she knew what the problem was, because when the semester or something, when we close and go back in Mombasa, she used to give me hot compresses, using a towel. We dip it in warm water and then she presses on the joints, and after that she applies ointment for relief of pain.
Over the next 15 years, Naomi navigated the complexities of living with the condition. The autoimmune disorder caused inflammation in her joints, leading to chronic pain and mobility issues. She has, however, had a fast right hip and knee joint replacement.
I did the knee replacement. That was 2007. Yeah. So after the replacement, I went back to Mombasa and I started going for physiotherapy at Coast General Hospital. I did it for like until to 2010 or 2012, I can't remember. Then this other joint also started experiencing pain, the hip joint.
However, as time progressed, Naomi found herself facing additional complications associated with rheumatoid arthritis, including joint deformities and severe pain that limited her mobility.
Okay, I wanted to go to India, but with time I realized it's better I do it in Kenya, for my family and my friends to be there for me.
After years of battling various symptoms and countless treatments, Naomi now faces another daunting challenge. She needs a hip replacement to regain her mobility and independence.
I'm pleading with you, anyone who is touched, anyone who can be able to help, please, I urge you to help me. This is not the life I want for the rest of my life. So please support me. This journey hasn't been easy. It is a journey of pain, struggle, waking up every morning, trying to give myself hope and not to give up. So kindly support me. Help me so that I can make my life better. I need to work again. I need to be on my feet. I need to go out there to get opportunities to work and support myself. I urge you Kenyans, please help me.
But financial constraint stands in a way. Today, she embarks on a quest not just for healing, a chance to reclaim her life. Now at 45 years old, after enduring over 15 years of living with rheumatoid arthritis, Naomi has reached a critical point in her journey where she requires hip replacement surgery. Financial strain became a pressing issue as medical bills piled up due to the ongoing treatment and therapies. Rheumatoid arthritis is a complex autoimmune disease that primarily affects the joints but can also have systemic effects. According to experts, understanding the symptoms of rheumatoid arthritis is crucial for early diagnosis and effective management.
So the earliest symptom of rheumatoid arthritis is just painful swelling of the joints and stiffness of the joints. It mainly affects the small joints of the hands and the feet initially, and any other joint can be affected. The unique thing with the rheumatoid arthritis is that it is symmetrical, meaning that if it affects the right hand, it will also affect the left hand. If it affects the right wrist, it will affect the left wrist. If it affects the right knee, it will affect the left knee. And if it affects the feet, similarly do the same. But it is not confined to the joints, the joints alone. It can also affect the neck and cause a problem we call atlanto-occipital subluxation, which makes the neck weak and can easily dislocate, especially when you are being intubated for purposes of surgery or other reasons. But it can also affect the blood system, so you end up with anemia or chronic disease.
Rheumatoid arthritis presents unique challenges for those affected. However, with proper medical care and lifestyle adjustment, individuals can lead fulfilling lives despite the condition.
Dr.
Omondi Oyo, a rheumatologist, underscores the importance of early intervention and comprehensive management strategies tailored to each patient's needs.
So when you get painful swelling of the joint, you need to seek medical attention. And the best thing that can happen is for a diagnosis. And one of the studies that we have done in this country, we have found out that if you report for treatment early, you respond better than if you come for treatment late. So you need to come early for treatment. And The treatments are many, and all of them are available in the country. Number one, we start with non-steroidal anti-inflammatory drugs to ease the pain and make you comfortable, and we use steroids to bridge, as a bridge when you are moving to disease-modifying drugs. And the disease-modifying drugs we have are like hydroxychloroquine, methotrexate, leflunomide, sulfasalazine. Those are what we call the synthetic disease-modifying drugs. But we also have biologic drugs, which are many: etanercept, adalimumab, infliximab, tocilizumab, tofacitinib. There are many drugs, golimumab, rituximab. So all of them are available in this country. So you just need to be diagnosed early and be treated early. And the earlier the treatment, the better the outcome.
Despite the many obstacles she has faced throughout her life due to rheumatoid arthritis, Naomi remains hopeful about what lies ahead. Her story is not just about struggle, but also resilience, a testament to human strength in overcoming adversity. As she prepares for this next chapter involving potential surgery and recovery, Naomi continues to advocate for awareness around rheumatoid arthritis while inspiring others who may be facing similar battles.
Hoping the physiotherapists will have been here by now.
Dolly Murikimbuvi for Hope TV.